Hello, everybody. Today I will introduce my article named The Evidence of Atypical Bipolar Disorder, Cognitive Function and Event-Related Potential Characteristics of the Special Anxiety Disorder compared to the typical bipolar disorder. I'm one of the authors named Nadu. And next, I will introduce my articles in these 4 parts. Let's begin the first part, the background. In clinical practice, some patients diagnosed with anxiety disorder may develop bipolar disorder many years later. We aim to explore the characteristics of these anxiety disorder patients from the aspects of cognitive function and electrophysiology so as to verify the existence of atypical bipolar disorder. We use these 4 parts of methods for the subjects. 48 patients diagnosed with bipolar disorder and 186 patients diagnosed with anxiety disorder were selected as subjects. Patients with bipolar disorder were mainly analyzed retrospectively, while patients with anxiety disorder were mainly studied prospectively with 3 follow-ups at the time of admission, 3 months and 6 months after acute treatment, respectively. At the time of enrollment, all subjects completed the demographic questionnaire, Hamilton Anxiety Scale, Young Manic Rating Scale, Yale-Brown Obsessive Compulsive Scale, Clinical Global Impression, Matrix Consensus Cognitive Battery, named MCCB, and the measurement of ERP, namely the event-related potential. In the follow-up, only HAMA, YMRS, YBOCIs, and CGI, these 4 scales, were performed on patients with anxiety disorder to evaluate the curative effect and to group them. Now let's go on with the results. For the first part of our result, there were 3 groups in total. The bipolar disorder group contained 48 subjects. The other 2 groups were established through follow-up observation. You can see the whole follow-up process was listed in Figure 1. In the end, 111 subjects were divided into the simple anxiety disorder group, namely those who were cured by the anti-anxiety treatment, and other 63 subjects belonged to the atypical bipolar disorder group, namely those who were cured by the usage of mood stabilizers after the invalidation of anti-anxiety treatment. Now let's look at the second part. We found that there were significant differences among the 3 groups in the scores on processing speed, attention alertness, working memory, speech learning and memory, visual learning and memory, in the scale of MCCB. By pairwise comparison, there was no significant difference between atypical bipolar disorder group and bipolar disorder group in attention vigilance, working memory, verbal learning and memory, and visual learning and memory, which were significantly different from those in the simple anxiety disorder group. Now let's look at the last part. We found there were also significant differences in event-related potentials and the latency and amplitude of MMN, P3A, and P3B among the three groups. The atypical bipolar disorder group and bipolar disorder group had the similar trend, with a significant difference from the simple anxiety disorder group. Now, let's turn to the last part. Our conclusions. We found some anxiety disorders with unique features might belong to the atypical presentation of bipolar disorder, and recognizing these anxiety disorders according to the screened characteristics in the cognition function and event-related potential will avoid the delay of treatment. Thank you for listening.